Hi everyone, my name is Lydia Habib. Today I'll speak to you about Not on Tobacco program. What is the Not program? It's an evidence-based program recognized by the National Registry of Effective Programs that was developed by the American Lung Association to help teens quit smoking. The target population for this program is teenagers who smoke daily, ages 14 to 19 years old. How does it work? It's a 10-week program consisting of 15-minute session a week with students during their normal school day, with optional 4 booster meetings offered to students. Professional facilitators that are hired by the ALA hold sessions. They use teen-friendly language to communicate with students. During these meetings, students are separated by gender in small groups of 10 to 12 students. Topics discussed throughout the program, as noted by Centers for Disease Control and Prevention, are motivation, stress management, the effect of smoking, preparing to quit, relapse prevention, dealing with peer pressure, media awareness, support networks, and healthy lifestyle. The goals of the NUT program are to help teens quit using tobacco and help them adopt a more healthy lifestyle after the program. According to the American Lung Association, studies of 1,200 teens participating in the NUT program nationally found that approximately 90% of the teens enrolled in the NUT program either quit smoking or cut back. Key questions. Does the NUT program help teenagers quit smoking tobacco? Was the program successful in each school? Determinants of health factor. Now that I have shared what the NUT program is, I want to discuss the determinants of health that can impact the effectiveness of the program. They are, first, socioeconomic status, which include the level of education and income. According to Schneider, socioeconomic status is the most important predictor of health. The higher the education and the income level for individuals, the less likely they tend to smoke. Teens who live in rural areas tend to use tobacco more than other areas. Parents living in those rural areas might not give more attention if those children need help to quit smoking. Second, social factors. Family and friends play a vital role in determining the person's health. For example, if parents don't care whether their children smoke or if the parents themselves are regular smokers or alcoholics, that can affect the youth. In some cases, students want to show off among their peers that they smoke and they compare how many cigarettes they smoke a day. Also, culture and traditions can have a huge impact. In some families' traditions, smoking is bad and forbidden. Third, behavior factors. Self-efficacy is one of the perceptions to understand individuals' health behaviors. Schneider mentioned self-efficacy is a sense of having control over one's life. Saying so, individuals who are aware of their bad habits and willing to change their old lifestyle to a healthy new one have a high level of self-efficacy. The NUT program is a voluntary program. Teens that are aware of their smoking habits and want to quit, those are the participants who join the program, and usually they don't go back to smoking again. The NUT program incorporated the target population's diverse perspectives in many ways. Since the program was conducted in several states like Florida, West Virginia, and North Carolina, students' needs were different. For example, in a study that was performed to help facilitators to recruit teens to the NUT program, participants from Florida liked to have an outsider guest recruiters, while teens in North Carolina found it very ineffective. Programs coordinators took all these diverse backgrounds and perspectives in consideration while developing the program. Also, the idea of separating students by gender is very beneficial and was an effort to tailor the program to meet each gender expectations. Public health priorities are to have a healthier and smoking-free communities. Promoting for tobacco quitting always has been one of the top goals. Also, public health encourages government, corporates, and state to enact laws that protect non-smokers, encourage individuals to quit smoking, and regulate how tobacco companies advertise for their products. At the same time, the NUT program helps communities to have healthier youth who represent the future pillars of progress. In this section, I'll talk about infrastructure. West Virginia State had the highest rate of teen smoking in the nation, knowing that since 1995, the West Virginia Prevention Research Center, which was funded by the CDC, partnered with the American Lung Association, the state of West Virginia, and other state departments and organizations to help develop a smoking cessation program for teens. And since then, the NUT program became a part of West Virginia's public health efforts. Additionally, the American Lung Association had a big role in the NUT program. According to the CDC, the American Lung Association adopted it as a national best practice model and is disseminating it widely. They also helped in training the facilitators of the program, created the curriculum, and helped start the program in high schools. This program involved many public health professionals, including researchers, public health advisors, school officials, and facilitators. The external stakeholders for the NUT program are regional coordinators. According to the Prevention Research Center at West Virginia University, regional coordinators are essential to the program's success. They are responsible for hiring facilitators. They also work with other stakeholders, for example, school administrators and community organizations, to increase the support for the non-tobacco program. Second, facilitators. They were responsible for conducting the program at schools and collecting data from participants. Third, teen smoker. Daily smoker students were the target population in the program. Resources were used to develop and implement the NUT program are schools were the most important community resource for the non-tobacco program. Creators used all possible sources from school and the participating states to help the program. These sources, including principals, teachers, counselors, students, and also school cafeterias and meeting rooms. Funding. According to the National Cancer Institution, the non-tobacco program was funded by CDC Prevention Research Center, West Virginia Department of Education, National Office of the American Lung Association, and the American Lung Association of Florida. Type of funding sources I would want for this program are money collected from raising taxes on all the tobacco companies. Big corporates should sponsor some of these programs financially, for example, pharmaceutical companies. There are some ethical concerns in the development or delivery of the non-tobacco program. First, minor consent and parents' approval. This program was developed for teens between the ages 14 and 19 years old. And since 18 years old and younger teens are considered minors, then parents' permission is required in order for their children to participate in such programs. In this case, teens may worry that their parents might find out about their smoking habits, resulting in some sort of punishment. Also, in some cases, parents are not interested in signing consent to let their children participate in programs that can help them quit smoking. Second, confidentiality. According to Messi and colleagues, students may feel scared to be punished by school administrators if they find out that they smoke tobacco. These ethical concerns could heavily impact the program. However, non-tobacco program was developed by conductors, school, and facilitators together to those teens who are willing to live a healthy life without causing any change to their lifestyle or exposing them to punishment. The main opponents for the non-tobacco program are tobacco companies. According to Centers for Disease Control and Prevention, cigarette advertisements are so attractive, and they are the main reason behind adolescents using tobacco. Also, as mentioned in a report of the Surgeon General, the three most heavily advertised brands are Marlboro, Newport, and Camel, were the preferred brands of cigarettes smoked by adolescents aged 12 to 17 years old and young adults aged 18 to 25 years old during 2008 and 2009 and 2010. Other opponents are economy and politics, which is I will explain further in the next slide. Factors contributed to the need for the non-tobacco program are: first, social factors. The main goal of public health is creating a healthier community. With the increased number of youth smokers and the community marketing views that showed smokers as cool individuals, the need to drive youth mindset to healthier lifestyle was needed. As reported by the Prevention Research Center at West Virginia University, 30% of teen smokers who completed the non-tobacco program reported to quit smoking. Second, economics and politics. Schneider Chapter 2 talked about how sometimes the government can put too firm restrictions and laws against tobacco companies because although the harmful effect of tobacco is well known, the tobacco industry is still a big industry that many people depend on for their incomes. Also, science and politics do not always support the same idea. Most of the times, political parties will try to ignore or fight scientific views that don't match their agendas. That's why the need for the program, like the NOT program, was critical. I believe that it was clear to public health advocates that fighting tobacco companies might not be the best way to promote for smoking cessation, especially with all these political and economic restrictions. However, educating youth about smoking hazards and harms will be more effective. Delivery. If I were attempting to get community buy-in the NOT program, I would educate parents, school administrators, and teens about how dangerous smoking is. According to Schneider, smoking tobacco became the leading cause of death in the last couple of years, since it causes cancer and heart diseases. Also, I would explain how the NOT program is beneficial as it provides all the support for the teens who are willing to quit using tobacco. As reported by Centers for Disease Control and Prevention, since 1990, more than 100,000 teens in 48 states have participated in the non-tobacco program, and given the effectiveness demonstrated from the 1999 through 2003, we can assume that about one of every six participants quit smoking as a result. So for my marketing strategy, I will involve two tactics. First, I will focus on educating community with all its components about the dangerous effect of smoking. And second, I will focus on demonstrating the advantages of quitting smoking and adopting a healthy lifestyle, using primary prevention not to begin smoking or quit smoking. How would I market the program? I would use advertising on communities' local channels, social media, using teens who already participated or currently in the program as representatives. As I mentioned earlier in my presentation, the National Registry of Effective Programs NREP recognized the non-tobacco program. Also, according to Centers for Disease Control and Prevention, the NOT program is included in the NREP's repository of science-based programs, and listed on the Substance Abuse and Mental Health Services Administration's Model Programs website, and is now a model program which could increase support for its dissemination nationwide. Accordingly, this program was successful for many reasons. First, it helped to reduce smoking rates among teenagers. Second, the curriculum of the program was delivered successfully to schools. And third, it was proven that the Not on Tobacco program was effective in many types of communities. Now I'll talk about the short and long-term effect of the Not on Tobacco program, starting with short-term effect. Quit smoking. Immediate health restoration. According to the American Lung Association, within 20 minutes, heart rate drops to normal level. In 12 hours, the carbon monoxide level drops to normal. Between 2 weeks and 3 months, risk for heart attack drops, lung function start to improve, and from 1 to 9 months, coughing and shortness of breath decrease. Also, reduces the number of smoked cigarettes for teens that couldn't quit. As mentioned by Centers for Disease Control and Prevention, that such smoking cessation programs can provide an opportunity to prevent initiation of tobacco use and therefore help persons avoid the difficulties of trying to stop after they already addicted to nicotine. The negative short-term effect I found were withdrawal symptoms that teens usually face, weight gain, and temptations to go back to smoking. Long-term effects. First, maintain health benefits. 1 year after quit using tobacco, the individual's added risk for coronary heart disease becomes half of that smoker. From 5 to 15 years after quitting smoking, reduced risk of having a stroke or getting cancer of mouth, throat, or esophagus. Second, the only negative long-term effect I found was that individual may feel tempted to go back to smoking tobacco for many reasons, including stress or being around other smokers. The NOT program is a very scalable program that was established in many states. The American Lung Association provides training and counseling to facilitators nationwide. Also, the flexible methodology of the program makes it sustainable and accessible in all regions. Here are my references. Thank you, and I hope you have a wonderful day.